Good afternoon, colleagues, and welcome to this important session. My name is Euan Woodward, and I'm the Executive Director of the European Association for the Study of Obesity, a federation of professional obesity societies from 36 European countries. And EASO coordinates the scientific secretariat of this EP Interest Group that will launch today. It is a pleasure to see so many attendees from a diverse range of stakeholders today. As you can see on the slide here, we are represented by civil society, researchers, policymakers, patient representatives, industry, and healthcare providers. So I'm pleased to hand the floor to my colleague, Jacqueline Bowman Busato, who will take you through the session's agenda. Thank you, Jacqueline.
Good afternoon, everybody. Great to see so many of you here. Next slide, please. So this afternoon, we're going to have the welcome and introduction by our chair, Pernille Weiss, MEP, as well as the president of EASO, Nathalie Farpour-Lambert. We'll then be following up with a very, I would say, very interesting Obesity 101 by Liesbeth van Rossum, followed by the first panel discussion, which you will be very, very welcome from the beginning to actually get involved. And that will be chaired by Pernille Weiss with Vice Chair Sara Cerdas, Vicki Mooney from ECPO, and Kremlin Wickramasinghe from WHO Europe. And they'll be discussing and debating the importance of why going beyond primary prevention in obesity is so important. We'll then move through to one of the very hot topics for good reasons around the strategic foresight process and generally building back resilience in health systems and beyond. That will feature as well our other vice chair, Susana Solís Pérez, Raluca painter from the European Commission, and Kirsi Pietiläinen, who is heading up one of the EASO collaborating centres of obesity management. And then, of course, what we will all be able to contribute to is summary and close. Where do we go from here? So with that, next slide, please. I'd also like to give you a couple of housekeeping tips. So we're here for 1.5 hours. We will not be going over time. Please, the age of Twitter, you can tag EU at EU obesity and use the hashtags obesity NCD, obesity policy to tweet. Please do. Please also know that we've dedicated Q&A sessions in the agenda. So you'll see those coming up every now and again with check-ins, so that you can actually ask questions of the speakers using the Zoom Q&A button. Please also note that this meeting is being recorded live through Zoom and will be available to all of those who registered, plus of course the highlights video, afterwards via both the MEP Interest Group website as well as EASO YouTube. So next slide, please. So on to our first question. For those of you that have a smartphone, you can actually point the camera at the QR and it will bring you the option to go to the website, which is joinslido.com, hashtag 149787. And there you'll be able to start filling in very quickly. Please get going. What do you see as the biggest priorities for the MEP Interest Group on obesity and health system resilience? For starters, we'll come back during the course of the session today, but what do you think? And go. That was direct. obviously the big one is disease recognition. Awareness. Conflict of interest would like to see some questions on that. Prevention policies, I think we're absolutely going to cover that. Real policy change. So the big one coming through, I see funding in there, language of obesity, strengthening primary care. I think it's safe to say that we're going to be having a very vibrant discussion on all of the elements around resilience and health systems. So I'd now like to hand over to our chair, Pernille Weiss, MEP, to take us through. Pernille.
Thank you so much, Jacqueline, and your wonderful crew of people in EASO. I am so delighted to be here this afternoon, and also to know that over 300 are actually in this meeting, because that will really raise up the value that we can create together on questioning and also to find the better answers to the very brilliant and important question, what can we do to fight obesity? And I'm also very inspired already by the Slido and looking out for all the good advices and ideas coming up already. So I very much look forward to this also kickstart of the MEP Interest Group, where myself and my colleagues, Sara and Susana from respectfully S&D and Renew Group, I myself, I'm in the EPP family, that we together can listen and learn and also co-create with all of you throughout this afternoon and get some ideas of how to get started in the right way and find the right dominoes of what we can do together in this term in the European Parliament, because that is what we want to do together with you. So thank you so much for attending, and also thank you so much for also what you share with us and also through the SoMe channels to make more people also to have more awareness about pre-obesity and obesity. Because we have learned it the hard way through COVID that if you as a citizen or as a family has a struggle with obesity one way or another, the risk of actually dying from COVID is very, very high. And to be honest, we know that we as Europeans, we in the Union, we get fewer and fewer, and we get older and older, and we also have a problem with obesity. And that is a challenge for the resilience and the robustness of Europe. And we have a great task together in developing and also in protecting the European way of life and our core European values based on family, based on Christian values and history. We have a big cultural heritage so that we, together with each other, must protect and also develop continuously for the next generations. And that's also a part of what we must touch upon in this afternoon, how to make the talk about health, the talk about obesity, and not filled with all the myths and the stigma that is linked to obesity, especially to raise awareness and give people more knowledge and also more tools to use when fighting obesity. And it takes more than a village to do so. We need the power of the Union, where member states, communities, municipalities, research, and a lot of clusters of people with skills, people with experience, people with courage, people with curiosity can co-create together. That is, from my part, what I would like to nurture and what I would like to do my utmost to facilitate and host for the years ahead. So welcome again, everybody, to this afternoon's kickoff of the MEP Interest Group on Obesity. And let me then welcome the chair of EASO, Dr. Nathalie Farpour-Lambert, who's a clinician and a very well-known policy maker at the Geneva city level, and also she serves of great importance to the community on obesity and evidence-based medicine and tools for health prevention. Welcome so much, and thank you for joining this afternoon. I know you will not be around for the whole session, but we agreed that we will link up together afterwards so that you can have a full picture of all the great ideas that are coming in today. Thank you so much, Nathalie. Over to you.
Thank you very much for your kind words, Pernille. I'm sorry, I was.
No, it's okay.
I had a doubt that I was on. So on behalf of the Expert Secretariat to the MEP Interest Group on Obesity and Resilient Health System, it's a great pleasure to welcome you to this very special event. EASO is especially delighted to be collaborating with such strong and capable advocate for the chronic disease of obesity. We have to remember that obesity has tripled since 1980, and now more than 25% of children and adolescents are overweight or have obesity in the European Union. So it is especially important to recognize obesity as a chronic disease. It has not been the case in the past decades, but we realize now with the COVID-19 pandemic that obesity is a risk factor for severe COVID-19, but also for many other chronic disease, mainly type 2 diabetes, so the diabetes associated with an excessive adiposity, but also cardiovascular disease. And we know more and more data now on the association between obesity and cancer, and many types of cancer. So we know now that obesity is a chronic, lifelong chronic relapsing disease, and we are very proud with the EASO to have contributed to the development of the definition of obesity as a chronic disease in collaboration with the World Health Organization, and this is now included in the International Classification of Disease 11. We know that obesity impacts health, but also can impact the next generations. There is more and more research showing now that childhood obesity lays the foundation for non-communicable disease. So in thinking about primary prevention, but also about care of people with obesity, we have to start very early in life and to take into account the whole population. Both as a policymaker at CT, but also national and international level, and as a clinician, I'm faced daily with the consequences of obesity, of pre-obesity already, and then obesity, and not being implemented as a chronic disease. We need more specialists. We need to train healthcare professionals. We need to improve, adapt our healthcare system to be able to provide quality care for people with obesity. And to date, we have some centers, obesity management centers with large expertise in this field. And with EASO, we have developed a network of obesity management centers, and more than 100 centers are now in this network. But this is not enough. We have, when more than 50% of the population is suffering from a disease, we need a strong health system to be able to take care of all the people who needs care. In 2021, we would not think about leaving someone with diabetes without care. We would not leave someone with a cardiovascular disease or with a cancer without care. So why do we leave people with obesity without care? This is unethical. So a role as the EASO Secretariat for this interest group will be to provide the bridge between the evidence and how it can be translating into meaningful policy solutions. As a community, we are here to work with you to find these solutions. We hope so. And we would like to share the knowledge across our communities and across our multi-stakeholder engagement channel. So it's really an honor and a great pleasure to launch this MEP Interest Group. And I wish you full success, and you can really count on the EASO team to support your actions and to help you to find a long-lasting solution for people living with obesity.
Thank you so much, Nathalie. Thank you for this message and promise. We will count on that. And now it is a very, very great pleasure for me to invite Liesbeth van Rossum to our keynote speaker position. Liesbeth is a former Woman of the Year in Rotterdam and the great author of Fat, as has made and still does make groundbreaking work to make science and biology on obesity to be communicated in a way where people like you and I can understand and use the evidence and good advice coming from Professor Liesbeth. I look very, very much forward to hear what you can tell us about obesity as a chronic relapsing disease, because that's a part of the stigma discourse that a lot of citizens and also colleagues of mine, they still relate obesity to something that is bound to lifestyle issues. So thank you so much for joining and give us a good foundation of evidence and facts on these questions. The floor is yours, Liesbeth.
Thank you very much for this very nice introduction. And I'm really thankful for having this opportunity to share with you why obesity is a chronic relapsing disease. And let me share my slides with you. I hope my slides are visible like this.
Yes.
Do you see my screen?
Yes, perfect.
Okay, thank you so much. So first of all, let's start with well, what's the definition of obesity? Well, actually, pre-obesity or obesity are both medical conditions, and they're marked by an abnormal or excessive accumulation of body fat, and that presents a risk to health according to WHO. And we define it also as a chronic relapsing disease, which in turn acts also as a gateway disease to at least 230 complications are known of obesity. And well known are, of course, diabetes, cardiovascular diseases, and cancer. And BMI, the body mass index, is a way to measure obesity, to assess it. And as you can see here, measured by the BMI, almost 60% of the persons in Europe is having obesity or pre-obesity or obesity, and almost 1/4 is having obesity. So that's a large number. Well, looking at obesity, there are several problems. One is, well, of course, there's an abnormal increased size and mass of the fat cells, and that can lead to either mechanical problems, joint complaints, for example, but also it's visible, and people are discriminated, for example, based on their weight. It can also lead to depression, also through other mechanisms. But then there's another important aspect of adipose tissue, because fat is an hormonal active organ. It's an organ. It's not only a layer of insulation or energy storage, it's an organ producing more than hundreds of hormones and other substances. You can imagine when you have too much fat, the fat is getting sick, just like a liver or a heart. And then in excessive fat, then you have an excessive production of all kinds of hormones and other inflammatory factors, and by the fat cells, and they also deposit all kinds of lipids in other organs, and that lead to all the diseases you know very well. Type 2 diabetes, cardiovascular disease was already mentioned, about 13 forms of cancer, but also other diseases, like, for example, now a very severe cause of COVID. Now, let me take you into the normal weight regulation. So as we sit here, our fat mass is being measured by the production of the hormone, the fat hormone leptin, that's signaling to the brain and telling basically your body, like a bathroom skill, how much fat is present in our body. And well, then this signal is received in the brain, and the brain says to the fat again and to the body, well, reduce my food intake and increase my metabolism. Okay, that's a very well-known normal weight regulation system we all have. This is very important because if this leptin system is defective, for example, in this patient, is one of our own patients, then you will get severely obese, suffering from obesity since childhood. And this girl, which is obviously different from her parents who have a normal leptin signal, she's always hungry, and she had also decreased metabolism. Now, this case is rare, and she had indeed a mutation leading to defective receptor, and she needs medication in addition to lifestyle measures. So this is rare, but when we look at people who are suffering from obesity, a sort of similar light version of this mechanism is present, because still the body fat is producing leptin, and actually a lot of leptin, but the brain becomes resistant to this leptin. And that means that the signal is not longer there to reduce your food intake. And the result is that all kinds of adaptive mechanisms will be present to promote weight gain. And this is one really important hormone, the leptin, so a measure of the amount of fat mass you have and a regulator of your body weight. But in the body, as we sit here, we all have tons of hormones which regulate this. And some hormones stimulate hunger, some hormones make sure you're feeling full. And do you realize that we make about 200 food choices a day, and the majority is unconscious, almost 90% is unconscious. And we are exposed to food clues the whole day. Let me do a small experience, or maybe sometimes you're feeling really full by these homeostatic systems, all these satiety hormones making you feeling full, and it's working properly, but still you can eat through it if you see, for example, or smell delicious food, because it's through another system, the reward system. And all these systems are normally present in all of us. And let's do a small experiment. And in this experiment, I ask you to just have a look at this chocolate. And imagine that this chocolate, that you smell it and take one, and now you will start making hunger hormones. This is very unconscious. This is due to the exposure to the visual or to a smell. And in the same line, also we stop eating when our satiety hormones come up. But the point is that people who have obesity, this whole hormonal regulation system is being disturbed. There are different feelings of hunger, and there is all kinds of adaptation mechanisms which make you gain weight. And this is a lifelong process. Once you ever had obesity, the body will always have obesity. The point is, are you controlling it or not? Let me give you an example. There are two persons, A and B. They both weigh 17 kilograms. but one person had been 120 kilograms in the past, suffering from obesity. The point is here that this person, this body and this brain has been reprogrammed. And after losing weight, it will persistently try to get a body weight up again. So that makes that it's a chronic relapsing disease, which needs proper treatment. And this is what we know from science a long time. We do have intensive lifestyle interventions, and yeah, you can lose weight initially. And there are just a few people who maintain their lost weight, because all these adaptation mechanisms make sure you gain weight again, unless you do a lot of effort with your lifestyle, or you have other treatments to control your body weight and to control the disease of obesity. Now, other treatments target this system. For example, pharmaceutical treatments or surgical treatments, they give sort of a reset of these disturbances of this hormonal system. So that leads to other mechanisms inside the body. And it's also good to be aware that there are many causes of obesity. We always think it's always lifestyle. And of course, an unhealthy lifestyle is by far the most prevalent cause of obesity. But in real practice, it's often that other categories can contribute, like mental stress or medication effects, or sometimes hormonal factors, common factors or diseases, or sometimes more rare diseases. And these can lead to obesity, but sometimes it can also be that a person has already obesity and other factors can make the diseases more progressive. Now, let me give you a quick example. And this is John. He was suffering from weight gain, and enormous weight gain, 30 kilograms in the last year, despite a very healthy lifestyle. And it turned out that he had a skin disease, was using creams containing corticosteroid hormones, and those corticosteroids are typically substances which are known to make you gain weight, especially abdominal obesity. And actually, after talking to his dermatologist, we could replace the creams with the same healthy lifestyle. He could control his obesity. So his weight was getting lower, mentally he felt better, but still his body is always struggling to go up again to the higher weight. But here is an example of a medication effect leading to obesity. So considering the treatments, there are several major modalities. And of course, it always starts with a healthy lifestyle. That's really something we should stimulate people and guide people also with. And in the Netherlands, since 2019, we have, for example, the combined lifestyle intervention, a 2-year program in the basic insurance, which is a beautiful first step. But in many cases, we need long-term guidance. And sometimes add-on therapies like cognitive behavioral therapy or other psychological therapies. Sometimes anti-obesity medication is needed, or bariatric surgery, because the body always wants to go back to the higher weight. So we need lifelong intensive treatment, and often it's a combination of these treatment modalities. So basically, to end with, I think this is the picture we are looking right now. There are two things here. The tap is wide open. So our whole environment, the biology and social factors, they all together lead to there are more and more people suffering now and developing pre-obesity and obesity. So the tap needs to be closed. But at the same time, we shouldn't forget that the bath is already full. And by closing the tap, the bath will not be empty again. You need to unplug the bath. And the bath is full of people having pre-obesity or obesity. So by recognizing that obesity is a chronic relapsing disease, it's now time to take obesity more seriously. How to, first, of course, we should close the tap, more and more prevention, whether it's lifestyle interventions, whether it's sugar tax, healthy environment, all kinds of measures can be thought of. But at the same time, don't forget that the bath needs attention as well, serious treatment. In practice now, we wait until the people with obesity develop cancer or heart attacks, and then we start intensive medical treatments. We should be aware that obesity is a disease by itself and should be treated well. And last but certainly not least, we have to take into account there's a lot of weight discrimination based on misperceptions, how it should be easy to lose weight. It's a chronic relapsing disease. It's not easy, but we can do it, but we need professional help in there lots of time. So thank you so much for your attention. And I'm really curious to do next panel discussions. Thank you so much.
Thank you so much, Liesbeth. And also thank you for giving us this metaphor of the bathtub. I mean, it's also a part of what we must do in the future is to break down the very complex knowledge into something that we can remember to every situation where it is needed for us to remember to think and think in a simple way, and also in a way where we can communicate further on, like this chain of information going from politicians and the valuable debates we have with researchers and experts, and how to break it down to something that also is meaningful to citizens in their daily lives. That's very, very important. Thank you so much. And also because this bathtub is actually pretty big, because I have learned that almost 60% of people in the union from 18 years and older is actually suffering with pre-obesity and obesity. Yeah, and that is a surprising number to me, to be honest, although the fact that I'm a health scientist myself and a nurse, I didn't know that the bathtub was that big.
It's enormous. It's actually more normal to have pre-obesity or obesity than having what we call normal weight. Yeah,
exactly. It's, and also, if you look on the health economy and the societal economy topics, 7% of the GDP is actually the cost of obesity to society. And also going through the recovery of our economy because of Corona, but also the pressure on the economy as a whole. We need to be very aware about how also we can strengthen our economy by addressing obesity without anxiety, and also doing it in a way that is personalized to every citizen and every family, and maybe also to every business entrepreneur, because it's also a matter of how to combine your work-life situation with tactics that you can incorporate when you go to work, because sometimes it's the peers on your work that can have this motivative talk and help us to open our eyes to new ideas and tactics, and maybe not our husband or wife who should do that part of it. So thank you again, Liesbeth, very, very much. And it's since Jacqueline said in the beginning that we will not overstep the time frame in this event, I will rush to the next session, introducing the panel, the very, very interesting panel for the debate on obesity as this chronic relapsing disease. I have with me Sara Cerdas, my colleague from S&D, my member of the European Parliament colleague. She's interesting because she's a former competition swimmer, as also she's a health scientist coming from Portugal. Thank you for joining both the Interest Group and also this event, Sara. Together with Vicki Mooney, who is the Executive Director of the European Coalition of People Living with Obesity. And also I have learned that Vicki is the presenter on Monster Radio in Lanzarote. So I will look up for that radio station to continue to learn more about your valuable messages, Vicki, that you will share with us in a short moment. Also with us, we have Kremlin, Wickramasinghe. Sorry for not being that good at pronouncing your name. You are the acting managing program head of nutrition, physical activity and obesity at HWO, the European region. I look so much forward to give both of you 3 minutes, only 3 minutes, in this round where you address why it is important for policymakers to go beyond primary prevention policies when addressing obesity as a chronic relapsing disease. So please share with us. And Sara, you will be the first one to take the floor for 3 minutes. Thank you. And I also must mention that continue to address your questions and remarks in the Slido on this event. We will go through everything of it, and maybe some of the questions also can be answered in this meeting. Sara, the floor is yours.
Thank you, Pernille. Thank you very much for introducing me. It's such a pleasure to be here and launching this interest group on obesity and health system resilience. Indeed, I was a competitive swimmer, but I only reached 157 centimeters, so I was there only for the junior part. So I'd like to start by thanking the EASO, the European Association for the Study of Obesity, for all the support and for the organization of this event, and you, Pernille, in particular, in setting up this interest group, which I'm very privileged to be vice chairing. It is very important to discuss, as a policymaker, to discuss with different stakeholders and create awareness on an issue that most often than we wanted is pushed to a secondary plan, and that is obesity. And for those that have followed my work since the beginning of this legislature in the European Parliament, you know that I usually try to strive for prevention. Because I come from a public health background as a medical doctor, I fully understand that a high investment in prevention brings higher outcomes. And it is also true that even with prevention, some health problems might appear. And we also need to address our efforts for the treatment and the caring for these patients. So obesity needs to be prevented, but it also needs to be treated, and it needs to be looked as a disease as such. And we must work together, all stakeholders, politicians, civil society, together with the health community and the patients, to establish the best plan and the best evidence to find this obesity pandemic. I mean, if it affects 60% of our adult population, it is a pandemic. I know we're a bit too much at loss with this word, but obesity needs to be dealt as such, and with the emergency that this entails. So just to finalize my 3 minutes, because then we're going to have some Q&A. We need clear, achievable, and realistic guidelines. We need to have the patient at the center of the process, and we need to be supported by national and regional plans that should succeed, because treatment is also a form of prevention, and obesity is a disease that will affect all our bodies and could increase the prevalence of other diseases. So if we're treating obesity, we're also treating and preventing other diseases, other potential diseases. And we now know that by treating obesity with treatment and long-term management, we could prevent up to 80% of type 2 diabetes and most 20% of adult cancers. So for you to have an idea, this will result in a very big burden for disease reduction at the EU. So I'd just like to finalize just my last seconds that the EU Health Programme aims to increase healthcare accessibility and reduction of health inequalities. And only by addressing obesity as a disease that needs to be treated could we aim to provide care and services to improve the quality of life of millions of people. So thank you very much for giving me the time. I look forward for the discussion.
Thank you so much, Sara. We truly have a work to do together, you and I, together with Susana, also to provide that national state levels, they respect the fact that the obesity is a chronic disease, because if we have the definition in scope, we can better also have cross-border cooperation and give each other inspirations of how to manage. Now the floor for Vicki Mooney. Please, you will answer and come up with some reflections on the same question that Sara did.
Thank you so much, Pernille. And also thank you, Sara, because it was so fantastic to hear your words ahead of myself. Now, generally, when we speak about obesity, I'm the Executive Director of the European Coalition for People Living with Obesity, but I'm also a patient first and foremost. And we don't hear words like fantastic ever, do we? There's never positive words when we speak about obesity due to the amount of weight bias and stigma, the lack of awareness of obesity as a chronic disease. Now, for this whole session, I want you to think about one person that you know that has obesity. One person, whether it's a loved one, a friend, a colleague. Like, it's statistically impossible to not know somebody who lives with obesity. And I want you to picture that person, because that is the person we are here to try and help and make a change in their life for. I suppose now that we're all on the same page after Liesbeth's brilliant presentation, we've had a lesson on the science of obesity. And we know that obesity is excess or abnormal adiposity that impairs our health. Now, there is many symptoms, psychological, functional, and we know that weight is just one of those symptoms. So when we think about weight, people have focused on that for decades. And not one country has reduced the number of people living with obesity in over 30 years, because we've focused on weight and weight management only, prevention. We haven't focused on treatment. We haven't focused on quality care and management. Now, if you think of some of the healthiest and fittest rugby players in the world, they are incredibly healthy. They do not have obesity, but yet when we look at their weight, majority of them would actually be put forward for some sort of medical intervention or bariatric surgery, but they don't have obesity. The number on the scale does not define obesity. So because we've only focused on prevention, this is a challenge that we have, I suppose, in our society, and we need to change that conversation. Stop focusing on weight and weight management. Let's look at obesity as a chronic relapsing disease. 15 years ago, I lost 90 kilos in weight, and I assumed that my obesity was gone. Due to my lack of awareness and education, I thought I no longer got obesity. But unfortunately, I regained 50 kilos because my own body, my own biology started fighting against me. My cortisol levels went up. I was exercising, but I was not keeping the weight down. My own grandmother, I think of my own grandmother, who is well into her 80s now and has been on a diet all of her life. She is one of the healthiest diets of anybody I've ever known. It may well be too late to help my grandmother when we look at treatment and management, but it's not too late to look at strategies and policies that focus on them now. Sadly, our society is decades behind, unaligned with the science, and we need public awareness and obesity as a disease for everybody. We need health literacy for everybody, and not just for patients, for every single person. We have a shared responsibility. We have worked, I suppose, with the clinical community for some time now, and healthcare professionals, some have only had 3 or 4 hours of education on obesity. And finally, as patients, we are at that table as equal partners in our health. So let's have the patients at the table for meaningful engagement in creating policies and strategies and public awareness that A, has stigma awareness in the framework so we don't do more damage, and B, addresses obesity as a chronic, relapsing and progressive disease in which we need affordable quality treatment, management and lifelong care for people like myself and that person that I asked you to think about. On behalf of the patient community, please do not leave it too late. Thank you.
Thank you so much, Vicki, for this strong message on how important it is to have a real and also a holistic understanding of obesity and the life journey that it is, both as the patient, the citizen itself, but I also assume for the family, for the partner, continuously. Thank you for your little story about your grandmother. Thank you for sharing. And now I will give over the floor to Kremlin, Wickramasinghe from WHO Europe. Thank you for joining us also in this afternoon. I know you have a lot on your heart and on your mind, and that also you know very much about obesity and the global perspective. So welcome, the floor is yours.
Thank you. Thank you for the invitation to you and also to EASO for inviting us for this session. And it's great to listen to Vicki beforehand and everything that she mentioned. Yeah, so from World Health Organization side, if I take a entrance to this specific topic, going beyond primary prevention, in our contribution to most of the diseases, is starting point defining what is a disease. And that comes with our International Classification of Disease, ICD. And we have our latest version, ICD-11, which countries use to recognize diseases. And ICD-11 says obesity is a chronic complex disease. So that is a starting point. And also it goes on, I'm not telling all the text, but to say that there are different levels of obesity and the recognize of different management options. So clearly this shows that as the scientific community, as WHO, where we need to look at evidence, where we need to summarize evidence, synthesize evidence, develop guidelines, which is suitable for different levels of obesity for management. So that's our main scientific work that we do to contribute beyond prevention. And we are continuing to do that. We have our guideline development committees constantly reviewing this. We may, when we talk about the relapsing nature, we may need to have a dialogue about how suitable is disease for children and adolescents. But we think for children and adolescents, this may not be the case. That's what some of our experts say. So we need to get into a wider discussion. But other than that, we really understand having very clear guidance and building the capacity in health systems for obesity clinical management is important. And globally, we are lacking behind in that. And that's not just for European region, for many countries. And also, one of the issues that we are trying to understand is sometimes it's very easy for us to polarize ourselves that I think prevention is important, I think management is important, or get into these corners, which is, we believe, unnecessary. And in WHO, European region, our regional director launched the European Program of Work, or known as, it's also known as United Actions for Better Health. In that, we say, not just for obesity, for many diseases, we need to bridge the prevention and clinical management sectors. We need to have a care continuum with a people-centered approach. So that applies here, and that applies to other non-communicable diseases. And that's what we want to do under the universal health coverage, provide all services that a person needs from the healthcare system without out-of-pocket expenditure. This shouldn't be an option only if you can afford, but this treatment, essential treatment services should be provided as part of from your healthcare system. Because NCD is such a burden, and if 80 to 90% of our disease burden is from non-communicable diseases, which obesity is part of that, our healthcare system should respond to that. And we have looked at how health systems are responding to obesity management, especially for children. We haven't really mapped how health systems respond to adult obesity management. It's a worthwhile exercise to do. Compare countries. Do they have guidelines? Do they translate them? Are those guidelines actually in practice if you do a clinical audit? And are healthcare professionals feeling comfortable to implement those guidelines? That's where WHO want to focus on next few years, translating our guidelines, building the capacity of health professionals, and really translate them into practice, clinical practice. And we have this opportunity with the cancer initiatives from WHO, from EU. There's a great discussion about cancer, but link this obesity discussion with that and use that momentum also to focus on obesity. So finally, I want to say from WHO side, we are very happy to support all national strategies, looking at primary prevention and management as a holistic approach. And we are ready to work, provide technical support with collaborators, researchers, our collaborating centers, professional groups, medical groups, and of course, ministries of health or focal points for countries. And I look forward to the discussion. Thank you.
Thank you so much, Kremlin. Now, when I look on my watch, I see we have a problem. Also, we in the time frame have a bathtub that is almost full. So let me ask the EASO team if you can give us one special question for the panel to give quick answers back to in order to keep the program in its proper flow. So EASO team.
I wonder if I might just do that, and I'm sure I will be supported by my EASO colleagues when I ask this question, which came in on the Q&A, but also close to our hearts as well. Considering the update of the definition from the JRC, do you expect treatment to be prioritized over prevention in the coming months and years? By which we mean the JRC recently recognizing obesity as a chronic relapsing disease. So will that lead to a prioritization of treatment over prevention? Because nowadays and historically, prevention has been prioritized.
That is a very interesting question, and I would like to put that forward to you, Sara. Also, with your health science background, I think you can have a say on that. Is it now the time for treatment to fight back on prevention, or can we find some kind of a balanced middle ground for both?
Yeah, this is a very interesting question, and especially where can we find that balance? Because you're right, the question was posed in a way, okay, we have been focusing so much on prevention, still we have these results. 60% is too many people. The prevalence is very high. So I would say that we need to reduce two things. Reduce the incidence, which is the number of new cases of obesity. I'm sorry for this very medical approach, but we need to reduce incidence. For that to happen, we need to still have prevention as one of the pillars. But another pillar should be treatment and follow-up. Is the story that Vicki told us, how this is a relapsing disease. So we must make sure that the patients keep still being follow-up. Let's make the analogy with another chronic disease such as cancer. One wouldn't want to choose between treatment of cancer or prevention of cancer. We must focus on the whole disease lifespan, and we must do that for obesity. There's many things that should be done. I'm aware that some of the attendees here are aware of the SPEL and ADEXO, which in Portugal they launched their website on rebalance the weight balance. And they basically come up with solutions and try to lobby together with the national parliament in Portugal to make this a reality. Some of their suggestions is towards prevention, some of their suggestions is toward treatments, but beyond everything, we need to have a follow-up for the patients. So the person should be at the center. Even if you are at risk of developing pre-obesity or obesity, and then having obesity, you need to be treated. Thank you.
Yeah, this is my way of saying now we round up. Thank you. You were nodding your head many times, Vicki. What is your take on this here?
I just love what Sara has said there. We've worked with Carlos Oliveira in ADEXO, the president there, for many, many years, and he was leading the way in policy for quite some time for the patient community. And I don't believe that we can do one without the other. You know, there has to be that balance. The challenge is, you know, getting that balance correct, you know, and having that kind of multifactorial approach. You know, we talk about obesity as a relapsing disease, but it's also progressive. It's a gateway disease to many other NCDs, and that in itself puts kind of the spotlight on why we need prevention, but also why we need treatment for people like myself who now have hypertension and various other chronic diseases as well. So yeah, let's open the table for that. I'm excited, Pernille. Thank you.
Oh, you're welcome. Maybe
Pernille?
Sarah, you and yeah.
Oh, sorry, if I may make a quick comment.
I can hear that's Nathalie speaking. You are still around.
No, just to say that there is always a discussion about prevention or management, but it's prevention and management. I just would like to remind people that when we improve the environment where people live, it's helpful also for people living with obesity. Because otherwise we would like them to have a healthy lifestyle, but they live in an obesogenic environment.
That's a good point, Nathalie, and thank you for that, because tomorrow or the day after, I know that there is a big conference on the European Bauhaus. So maybe we should actually put obesity in as a part of the equation for the new European Bauhaus. That's a good idea. Thank you for that. Vicki, do you have something more to add?
No, I'm conscious of our time as well, so happy to move on.
Thank you so much. Kremlin, seen from your helicopter perspective, what didn't we touch upon on this very important question?
No, I think if we all want to improve the clinical management of obesity, that means we need to have space for clinicians to focus to provide good quality care. So if the numbers are overwhelming, if they cannot manage, we will not be successful on any side. So in order to be manageable for health system, we need to keep focusing on the prevention side to reduce those numbers Sarah mentioned, to reduce the new cases coming into the management. So that's why I think we need both. And on the other hand, I don't want participants to think that prevention has failed. No, what has failed is we have not implemented prevention strategies adequately enough. That's why we don't see the potential of prevention can offer to us.
Yes.
So those two things are leaving.
Yes, a very important point there, Kremlin. Thank you for that. And then we end this session and taking a little commercial break. Over to you, Jacqueline, telling us about what is coming in from the SOMI channel and the board, the one that you can write your comments on. Is you there? Are you there?
I'm definitely here.
Thank you.
In fact, we were just scribbling behind the scenes to say we're going to come back to that a bit later, because what we're seeing is a lot of questions coming up, certainly in the Q&A, asking about language of obesity, being very enthusiastic about the approach of this first panel in terms of actually getting a plan, having an exit plan that involves both primary prevention as well as most definitely dealing with the almost 60% of people that still need long-term treatment and care. So I think it's safe to say we're on the right track. And in fact, at the tail end of this panel, we started moving into a very nice segue towards foresight and resilience, because with foresight and resilience, a lot of the points which just came up are actually there. So,
perfect.
So before I hand back to you to actually drill into all of this, Pernille, I think a little explainer for everybody, because foresight and resilience is a hot topic in Brussels, and everybody at national and territorial level right now is being pushed literally into creating their post-COVID resilience national plans. Now, this is embedded in two elements. The first one is the strategic foresight report from the European Commission, where they specifically mention as two non-communicable diseases, so two chronic diseases, obesity and cancer. So we are already in the frame on paper. This is very much a matter of how do we move forward. So using foresight, so being able to not exactly foresee change, but certainly to be able to deal with it better in a more flexible way. Resilience, some people will know this already, but I would guide you, as have various committees within the European Parliament already done, to look at the WHO Europe, and particularly the European Observatory on Health Systems and Policies, they produced a brief on how to make health systems more resilient. They focused on financing, sufficient and flexibility, governance in terms of participatory leadership, effective information systems and flows, and then resources, both physical as well as structural, to make sure that actually our future is fit for purpose. So with that, I hand back over to you, Pernille, to discuss with the panelists how we can get there by putting obesity in the center.
Thank you so much, Jacqueline, and also thank you, next panel, for joining us, and especially welcome, a warm welcome to the other vice chair of the MEP Interest Group, my colleague from Renew, Susana Solís Pérez. I remember when I asked you to join the group, you said, well, I'm an engineer, so to what use can I be? And I said, we really need an engineer, because going back to the bathtub metaphor, we have to close the tap, but also to unlock a lot of other channels of resources, of tactics, of both treatment and prevention tools to be used. So Susana, so much welcome, and thank you for joining us. Together with Raluca Painter, the head of the unit of DG Reform, Labour Market Education, Health and Social Services in the European Commission, together with Kirsi Pietiläinen, Uhlenberg Professor in Clinician Metabolism, Obesity Research, University of Helsinki. Also, warm welcome to you. All of you, the same constraints, only 3 minutes for asking this session's key question: what are the key challenges facing us in ensuring that addressing obesity is at the center of resilient health systems? Susana, you are first on the floor. Welcome.
Thank you. Can you hear me?
Yes, we
can.
Thank
you very much. And first of all, it's a pleasure for me to be here today, because as Pernille told before, when she asked me to join this intergroup, I did not doubt for a moment to join it, although I am an engineer myself. I think it's very important, because today we are setting the first stepping stone to raise awareness on the challenges and the barriers we need to overcome to change the status quo of obesity. And I think it also comes in a very timely moment, because I truly believe that now is the moment to act. Now, more than ever, we have the political willingness to build resilient healthcare systems. Because, you know, it is now considered a strategic priority in Europe. And this time we have the structural funds, but also the recovery funds to change it. And answering to the question, I think we can all agree that the key challenge to a resilient health system is to advance in digitalization. Digital tools allow alternative and flexible approaches to deliver care, and also increase the overall efficiency of the sector. But for this, we need the full development of the common European health data space, which will enable data exchange and interoperability of data. You know, this is now a priority for Europe, because the crisis has revealed a lack of readiness in all the data economy. We need this. We need data for artificial intelligence to accelerate the development of treatments, vaccines, predict the spread of diseases. And we need data to tackle obesity. And in the context of obesity, this requires, I would like to say 2 things: a clear interconnectivity and interoperability between data collected and harnessed for obesity and for the other 230 medical complications linked to obesity, and a EU health data space that takes into account existing specialized obesity centers of excellence and integrates them virtually, but also physically into this equation. Because right now, one of the challenges of the EU Health Data Space Policy Initiative is that it assumes that all applicable chronic diseases have already been implemented. And as you know, this is not the case for obesity. And as a result, some of the key proposals on the table will not be accessible, which can have a tremendous impact in the prevention, treatment, and long-term management of these chronic patients. So that's why we need a new approach to obesity that is embedded in the EU health data space. And let me mention just very briefly the rural areas, because as published by several studies, we see that obesity has a bigger impact in rural areas than in cities. And digitalization has the potential to assure equality access to healthcare in these areas beyond primary care. So in conclusion, advancing and investing in that direction of digitalization, safe data sharing in common space, and giving obesity the status of a chronic relapsing disease. Those are the key challenges. And now that we have the funds and the political intention, it is the moment to put on the table innovative approaches to tackle obesity and create more resilient healthcare systems.
Thank you so much, Susana. I am so happy to have an engineer on the team because let's get data down and crunch it and make it work. And also you have a very strong point on, yes, we have the resources right now, and it's about time. It's a make or break moment actually that we are facing. So maybe together we should help each other to remember when we assess the national plans on the RRF, the Next Generation EU funds, that we will look carefully towards what the national plans and initiatives are also in relations to obesity. That we will remember that. Next speaker, Kirsi, are you with us and ready to take the floor? Because I would honestly like for us to have the final speaker from the DG Raluca. Is it okay with you, Kirsi?
That's completely okay. Yes,
okay,
I'm here.
Perfect,
you hear me?
Perfect. So did you get your patient work done before?
I did. I was right on time.
Thank you.
So thank you so much. Thank you so much, Pernille, and thank you so much for this opportunity to say my regards from Helsinki, Finland. So I'm representing North Europe. So this is an extremely important event, and I'm so glad that I get to have a say here. So I work as a medical doctor in the obesity specialty clinic. And how I see this is that actually what the healthcare system is now struggling with is, of course, the COVID. But the problem here is that the resources, the little resources that there were for obesity before COVID are now only taken to COVID treatment, diagnosis, vaccination. So what happened actually here, at least in my town in Helsinki, was that nearly all the nurses everywhere else, in all the healthcare centers, all the nurses, all the doctors, they were taken to COVID work from obesity. So the little effort that we had for obesity is now taken away. The only place where we can treat obesity is here at the specialty clinic. But look, we can only take a few patients every day, and this does not in any means replace the work that was previously done for healthcare centers. Now, almost 10 years ago, we had the first SARS epidemic. So then what happened was that the same thing happened. Obesity resources were also taken away to treat the SARS and vaccinate and, you know, everything in there. What happened afterwards? It only lasted for half a year, but the resources that were taken away from obesity, they never came back. Now there's almost a 10-year gap in the routine work, in the work that was previously done by nurses who are very well aware of how to treat obesity. So we lost all these nurses, we lost all the interest, we lost all the know-how on how to treat obesity. So what I'm fearing now is that the same thing will happen now after COVID, but to a much more bigger effect, of course, because this is much bigger epidemic than it was 10 years ago. So here's where we need the European Centers for Obesity Management, the COMS centers. we need the excellence that we have. We need to have a national specialty care centers who can then disseminate the know-how to healthcare centers and also serve as experts that deliver information to general public within the whole Europe. So there's now a lot of work to do in the EU. And I have two more points. One of the points is for the politicians. Many politicians are actually afraid of talking about obesity. So now I think that it's time to start talking about obesity in a friendly manner, in a good manner, understanding that what's the biology behind obesity. And then the second point is to really think through which kinds of actions can we now take. We need to identify the barriers that we have. Why don't we treat obesity? Why don't we start treating obesity again after COVID? What prevents us from doing that? And that can vary from country to another. So, but there's a lot that we can do now together as EU citizens. And especially I call upon every politician that have the power and the knowledge on how to deal with public things like this. So thank you very much for this opportunity.
Thank you so much, Kirsi. And on a personal note, very much also thank you for asking us to not be scared away from talking about obesity. And I think it's a very valuable message for you, and also a push to Sara and Susana and me to sit down and have a coffee and talk about how can we take out an anxiety between our colleagues and then engage with creativity, and also with the relationship building to the national level and the national care center structures that you also asked for, Kirsi. Thank you so much for that. And
Thank
now
you.
for the last panelist, Raluca Painter from DG Reform. It could be easy to ask you the same question, but also if you cannot hold yourself back in also addressing a question like, what would you like to see happen from policymakers and from Susana and Sara and me and our colleagues in the European Parliament? Don't hold yourself back if you have some key messages to put forward to us in the next 3 minutes that are yours on the floor. Welcome, Raluca.
Good afternoon. Thank you very much, Pernille. Thank you, Jacqueline. Very happy to be here today, and very honored as well, because I'm not a specialist in obesity, but I'm here to raise awareness on a service of the European Commission, which could be useful when we think about how to take the discussion forward and how to engage with member states to raise awareness, and ultimately how to help people that are facing this problem. So as you kindly introduced me, I'm heading a unit which deals with technical support to member states in the areas of health, education, labor and social services. So I'm part of the Directorate General for Structural Reform, DG Reform, put shortly. And this is one of the most recent Directorate Generals of the Commission. It was created last year in January, but on the basis of an existing service which functioned for a few years, the Structural Reform Support Service. And what I'd like to emphasize today is the type of service which is provided by DG Reform, because it is quite a unique instrument in the sense that we're not giving funding to member states, but we're accompanying them when they wish to undertake reforms in the area of health, for example, starting from the process of identifying the needs, designing the reform, implementing it, and then monitoring the implementation. So we're, the key feature of the service is that we're demand-driven support service. So we're acting whenever we're asked by member states. And the way we act is that we're using our our expertise, but we're also working with international and European organizations or universities, for example, WHO, the International Organization dealing with cancer prevention, OECD, and so on. And I think this service is very useful because, as I said, we step in when there is a need to accompany member states, when we can facilitate the exchanges on best practices which exist at national level. And of course, we're working with DG Santé and other DGs in this process of accompanying member states. And to give you some examples, because I don't have an example yet on obesity, for example, but to illustrate the type of work we're doing, we're assisting member states currently on preparing e-health strategies, telemedicine, trying to put on strategies on the health of the workforce, for example, the performance assessments of health systems, or improving the primary care or long-term care. We're also working on improving prevention, treatment, and aftercare diseases like cancer, for example. So the range of services, if you wish, and ongoing projects is quite broad. And as I said, we can cover even further issues depending on the needs which are highlighted by member states. And in terms of process, we're having an annual selection process. So we invite member states by the end of October to submit of each year to submit their requests. And then there is a selection ongoing in collaboration with other Commission services to retain those that we would serve, knowing that generally we receive more requests than we can actually serve. So this is in a nutshell the service, and as I said, we're open to further assist member states, and I think raising awareness about how we can be helpful is very important because of course we complement other EU instruments which are there to provide financing. We're functioning on the basis of the technical support instrument, which is a new funding instrument for 2021 and the next 7 years. But as I said, happy to engage in further conversations on how to take these issues forward. Thank you very much.
Thank you so much, Raluca. And while you were telling about your unit and what it can do, I just maybe it's a crazy idea, but I risk to make a laugh of myself that maybe Sara and Susana and I, coming from Portugal, Spain, and Denmark, should sit down together and try to maybe draft a project organization for how our 3 countries can ask for some help from your unit, in order also to try to investigate in how to nurture that member states, they find out what they don't know they didn't knew about obesity. Because as I understand what you're saying that you don't have yet a case on obesity. Okay, then let's try to create a beautiful first case for us to work with also in the MEP Interest Group, because the core object for this interest group is to raise awareness to the rest of the colleagues in the parliament, but of course also very importantly to our member states, to make the union really reach the highest possible level of resilience, and also in tools to fight obesity. And there is no such thing as a silver bullet or one solution fits all. So maybe you don't have to decide right now whether you would like to see an application coming from Susana and Sara and me, but I can see that Susana is nodding her head, so maybe, yes. I have triggered something
we will come
from
back
you.
to this.
Yes, we will come back.
If I may take just one moment to
Yeah.
respond to you, because I forgot to mention one important aspect, and it's very relevant in relation to what you're saying, is that so far we've been engaging generally with like one member state, one project. But because the needs are quite numerous, what we're planning to do as of this year to also try to engage on a multi-country basis. So already what you say, having, especially for this type of issues that need a lot of work, you know, preparation, reflection, collective reflection.
Yeah.
Indeed.
Exactly. And also to play each other stronger, if we can use this football metaphor in this week of FIFA, also maybe that is the way to see how we can also foster ripple effects where the cross-border collaboration is growing without only being every time pushed by the EU institutions. I mean, let's see what works. So back to the questions, the many questions that we will not be able to answer in this afternoon because of the time frame. And sorry for that, but we will definitely look over all of them. But is there one very valuable and tricky question that we can have just in a quick round in this panel? Then bring it please forward, Euan.
It's my turn now.
It's your turn, Jacqueline. Okay, please take the floor.
So the big one that I see here is actually a question on discussions on obesity have been happening. The problem is implementation and delivery. So and implementation and delivery is a two-way communication between providers, patients, and also information technology. So is there an approach that we could work towards that would actually make that happen? And I'm guessing that that's a good one as well towards Susana, as well as towards Kirsi.
Yes.
But very briefly, because I agree with you. Now we need to have to deliver measures, and we have to deliver solutions, and that's why I was focused on the resources that we have now. We have resources, and we have to make sure that the national plans, that the regional plans cover the obesity now, and that's why we have to use the funds, and we have to make sure in the European Parliament that we not just communicate, but because we have learned today how to communicate better, but we put measures in place in each member states. We will have now the opportunity, and I would say now or never, to deliver.
Kirsi?
Well, in my mind, the European Centers for Obesity Management has been a very important initiative, because obesity treatment is somewhat similar in every country, but at the same time, we have differences in each of the countries. We have different reimbursement systems. In some countries, like in Finland, almost anybody who is eligible for bariatric surgery, for example, can get bariatric surgery for nearly no cost. But that's not the case in every country. So what we need to bring ourselves together to understand that what's happening in each of the countries and how to generate common guidelines within our EU community. However, then in each of the countries themselves, we need to act as well. So we in Finland, for example, what we have is very good, is that we have a huge digital treatment of obesity, which many other countries could benefit from. We treat 2,000 patients every year, and that has doubled now during the COVID time. So I think that once our face-to-face treatment has been pushed down, what we need to push up is the digital treatment. So we can learn from each other, but we also need to know that what specialties are there in each of the countries.
Exactly, exactly. Thank you for that point. And also that was maybe my idea with the Portuguese, Spanish and Danish project that we can create. What do we know about each other, and what do we not know that we can share with each other? Thank you so much, Kirsi. So I can see on the face of Jacqueline that now we are entering into the very final minutes of this wonderful afternoon, where I think I can say on behalf of all of us that it was a very meaningful and learningful and intriguing and inspiring, and to some extent also provocative afternoon. We really have to do something now, and we have a lot of something ideas on the table right now, and also in the cloud where it's in the background. Thank you so much for that. And also thank you very, very much, Jacqueline and your team, for bringing all this together. It is your efforts that we are happy to toast with. So thank you for that. And also thank you to all the panelists and the keynote speaker, Liesbeth. I saw Kremlin was walking away just briefly saying hello. So he has had a good afternoon together with us. It is a pleasure for me now to embark together with Susana and Sara. I know that for the next couple of months, we will in this house focus a lot on the national plans on recovery, but also on the pharma strategy. So I think that will be on our agenda just for the weeks ahead and months ahead. But after summer break, we will be hopefully political obesity engineers together, tapping into all of the good ideas that came. For the final minutes, I would like to give 2 minutes for each of you, Susana and Sara, starting with you, Sara, for your closing remarks for this wonderful afternoon. Sara.
Yeah, thank you, Pernille, and also to Susana. Just a quick words from my side. First and foremost, to thank for such lovely event. I think it didn't look like the time passed here. It passed really fast, and that happens when it's such an interesting topic together discussing with such inspiring people. So I believe I'm looking forward to work closely with Pernille and Susana from the Parliament side, and perhaps have this Danish, Spanish, Portuguese coalition. I'm pretty much looking forward for it. So to understand what can we do from this side, I think I can say that you can count on us to advance this issue at the European Parliament, but we need everyone, and especially those that are involved, the different stakeholders, and hence my big thanks to the European to the EASO for organizing this event and for all the support. So it's been quite an event, and I look forward for the future work we're going to develop in the near future. So thank you very much.
Thank you, Sara. Susana, can you top this one?
Yeah, thank you very much. I think we need more debates like this, and we need to encourage more politicians to have these open discussions on obesity. We need to put an end to the stigma. And I have to say, today I had inspiration, facts, evidence. Today we learned ways to communicate better. I will always remember the tap and the bath example. And as policymakers, I think the launch of this interest group is a call to actions. We have to deliver solutions now to make sure we invest in prevention, in treatment, we stop discrimination. And we have a lot of key takeaways from today's events for this coalition. And yes, and it is, I think, categorizing obesity as chronic relapsing disease should be our objective. And you have the commitment of all of us to work on this in the Parliament. Thank you very much. We will together. through all the committees, through all the possible ways, but you can count on us, and thank you, because it was a gift. Today it was a gift for me to learn so much about obesity.
Yeah. I think honestly, Sarah and Susana, I think we three can make it to also have the council to commit to the fact that obesity is a chronic relapsing disease. Shouldn't we also put that on our agenda of to-dos for the next couple of years?
I agree.
Okay, so Jacqueline, EASO team, thank you so much for being together with us and all the wonderful panelists, the keynote speaker, and the audience of over 300 people. Thank you so much. I look forward to see all of you very soon so that we can get on with the work. Take good care and stay happy.
Thank you very much.
Thank you very much, everyone. Wonderful. Thank you so much.
Bye-bye.
Thank you.
Bye.
Bye.